And on to a big story from Mizoram now. Well, Mizoram will not have sufficient health centers if the COVID-19 cases continue to rise in the state as predicted. Stating this, State Health Minister Dr. R Lalthangliana said that as per predictions, COVID cases may rise to 5,000 by December. Dr. Lalthangliana further said they expect a further rise of around 2,000 more positive cases and stated that the state's present health infrastructure will not be sufficient to deal with the rise in numbers. Dr. Lalthangliana said that the state government has prepared a contingency plan and Chief Minister Zoramthanga has approved it. He further said the government is trying its best to set up as many COVID care centers as possible with support from the YMA and churches. At the meeting, the officials decided that the government will continue practicing the guidelines of keeping COVID-19 patients under care at COVID care centers, dedicated COVID health centers and dedicated COVID hospitals until they test negative. However, if the positive cases continue to rise to a point wherein there is not enough room to admit all the positive patients, the guideline will be reconsidered, the Health Minister said. The Health Minister further said that there are 4 new sites proposed to be COVID care centers, which are JNV School at Thingsultiala with 318 beds, Montfort School at Mildriat with 86 beds, Joliet Special School at Buckwan, Aizol with 53 beds and SIRD Hostel at Thingsultiala with 25 beds. Well, Dr. R Lalthangliana expressed regret that certain villages and localities do not permit setting up of COVID care centers in their area and said there is a need to raise awareness amongst these people that it will not pose danger to the society. And to know more on this, we are being joined over phone line with our correspondent Isaac Zoramthanga from Aizol. So Isaac, what is the contingency plan of the state government to deal with the situation, Isaac?
Yes, as of now, the state today's meeting decided that the state these COVID care centers, which maintained by the state government, has been right now it's still sufficient for the COVID patients as of now, but like it will in the coming days, like it might the cases might rise. So yes, these contingency plans have been made, and even this COVID creation of COVID care centers, especially in the district capitals and some of the popular cities like which are nearby to the capital of the district. So the contingency plan is yes to create more COVID care centers, and yes also like to also to get in talks with the local level task force, so that they could create their even their halls and even their localities halls also to the COVID care centers. Yeah.
And Isaac, what is the current intake capacity of the state, and do they have a plan in place to raise it to 4,000 to 5,000 by December?
The capacity of this, especially in this Zoram Medical College, the capacity of bed is 783. So, but as of now, like they are only among all the active cases of these 382 active cases, only 64 are in Zoram Medical College, while all the others are in other COVID care centers. So yes, but when the time comes, and if the cases might rise, and if the cases might reach up to 5,000. So it will not be sufficient for all the COVID care centers we have now, but yes, the state government will make some actions, and some actions will be taken by the state government. Yeah.
All right, Isaac, thank you so much for all those details.